The heart valves plays a crucial role in regulating the blood flow into and out of the heart. Valvular heart disease is a common form of cardiovascular heart disease that primarily affects the heart valves. Hi, I'm Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss about aortic stenosis and its latest advancements in treating this condition. Joining our discussion today is Dr. Pawan Poddar, Senior Interventional Cardiologist from Yashoda Hospital's Malakpet. Welcome to the program, Doctor.
Thank you.
So aortic stenosis is a common valve problem leading to significant health implications. So to begin with, what exactly do we mean by aortic stenosis, Doctor?
Let me simplify it for my viewers. Generally, we have 4 valves in the heart, 2 on the right side and 2 on the left side. So the left-sided valves, one of them is the mitral valve and the other one is the aortic valve. The main function of the valves is to direct the blood flow in one direction so that the blood doesn't come back. And the aortic valve, generally it comprises of 3 leaflets which open in one direction. The blood goes in one direction, then the valve closes. It prevents the blood from leaking back into the left ventricle. So aortic stenosis is a disease of the aortic valve where the 3 leaflets, they fuse or they join to one another and the opening of the valve is restricted. So the enough blood doesn't eject out from the left ventricle into the aorta. So it is a condition where the leaflets get fused and the opening of the valve gets restricted.
So discussing about aortic stenosis, Doctor, are there any potential risk factors or is there any particular age group which are affected more?
Aortic stenosis, it can be seen in different age groups. Some conditions are congenital, that is, it is seen in young children, and there is some congenital abnormality in the development of the valve, and many times it presents in childhood. And the other extreme, there is another condition which is related to the aging process. Because of the aging process, a lot of calcium gets deposited in the valve and the valve leaflets fuse and they don't open properly. This is seen in very elderly people. Most of these patients who develop age-related aortic stenosis, they are above 65 or 70 years of age. And there is another condition which we call as bicuspid aortic valve. This is also a congenital condition. Here, instead of 3 leaflets, people are born with only 2 leaflets of the aortic valve. These 2 leaflets, they tend to function well in many individuals till the age of 50-55, and after 50-55 years of age, sometimes these leaflets fuse and they develop aortic stenosis. So we have 3 age groups. One is the children where it is congenital aortic stenosis, and then we have a middle age group about 50-55 years of age which is related to bicuspid aortic valve, and then we have the extreme age group above 60 or above 75 years of age which is related to the aging process.
So more or less, aortic stenosis can affect any age group. So are there any symptoms or any red flag signs that one should be aware of, Doctor?
Aortic stenosis, most of the symptoms present with 3 classical symptoms. One important symptom is breathlessness on doing some physical activity, breathlessness on walking, on climbing stairs, or doing any other physical activity. That is one of the very common symptoms of aortic stenosis. Apart from that, the patients can also have angina. Angina is nothing but chest pain. When they do any physical activity, sometimes patients who have regurgitation of this valve, they can have angina while in sleep also. And the third important symptom is sometimes they can have syncope. Syncope is nothing but sometimes momentarily patient will lose consciousness, they will fall on the ground and they recover immediately within few seconds. So these are the 3 classical symptoms of aortic stenosis. Because of presentation with chest pain, sometimes it is confused with coronary artery disease also.
So discussing about aortic stenosis, Doctor, how is this condition diagnosed and how is the severity determined?
Single most important investigation which can diagnose aortic stenosis is echocardiogram, 2D color Doppler and continuous wave color Doppler examination by echo will lead to diagnosis of aortic stenosis. Aortic stenosis generally has 3 stages. First stage is called as the mild aortic stenosis. where the movements are little bit restricted, but there's enough blood which flows from the ventricle into the aorta. Then we have the second stage, which is the moderate aortic stenosis. And then we have the third stage, which is called as the severe aortic stenosis. All these three stages generally can be diagnosed by pressure gradients, which we can measure on the echo. So on echo, we can establish the diagnosis of aortic stenosis, and we can also tell which stage of aortic stenosis the patient has based on the echo findings.
So I'm sure there are different types of heart valve replacements which are available for treating this condition, doctor. So what are some latest advancements which are available for treating this condition?
The mainstay of treatment is valve replacement. Here again, way we do it, it varies from it depends on the age of the patient. Suppose when a patient below 65 years of age, if he requires aortic valve replacement for a severe aortic stenosis, then for this age group, generally we will prefer a metallic valve. And metallic valve replacement can be done only by surgical means. And there's another age group, the age group above 65 years of age. In this age group, generally we prefer a bioprosthetic valve, not a metallic valve. So in this age group, the people have two options. Either they can go for a surgical aortic valve replacement, or nowadays a minimal invasive therapy has come, which is called as the TAVI, transcatheter aortic valve implantation or transcatheter aortic valve replacement. So this is the new thing which has come up in last 1 decade. Many patients have been implanted with TAVI in the last 10 years all over the world. And this therapy is comparable to surgical aortic valve replacement with bioprosthetic valve.
So TAVI or TAVR is a minimally invasive procedure which is done to treat aortic stenosis. So are there any particular advantages when compared to conventional surgery, doctor?
TAVI or TAVR, it confers many advantages to the patient. One important advantage is it requires a very shorter hospitalization. Most of the patients can go walking from the hospital within 48 hours after the procedure. Second major advantage is it doesn't require general anesthesia. There are no cuts or no surgical marks on the patient. It can be done through a small hole through the patient's groin in the artery. And it carries very less morbidity and mortality compared to surgical aortic valve replacement.
So recovery after cardiac valve replacement is a significant concern for patients. So could you brief us as to what steps patients should follow for a smoother recovery?
Most of these patients who require aortic valve replacement, whether surgical or transcatheter aortic valve replacement, they are quite elderly and they are quite sick. Many of them have a lot of other comorbidities such as diabetes, hypertension, and age itself is on the higher side. So many times once this patient undergo the aortic valve replacement, they require good rehabilitation. There are a lot of hospitals which offer a good rehabilitation program, and they need to take some blood thinners also. For TAVI and for bioprosthetic aortic valve replacement, we give antiplatelets. We don't give very powerful blood thinners like anticoagulants. But patients who undergo metallic aortic valve replacement, they need to take anticoagulants for the rest of their life. Patients who are on anticoagulants, they need to follow a certain diet. They have to avoid green leafy vegetables, and they need to take a blood test every month, which we call as the PT-INR. They have to keep their PT-INR between 2 and 3. So this is a important precaution for patients who undergo metallic aortic valve replacement.
So before we wrap this episode, doctor, is there any message or advice that you would like to give to our viewers as far as cardiac valve replacement surgery is concerned?
What I would like to say to my viewers is that aortic valve replacement is a very lethal disease, but it can be diagnosed simply by doing an echocardiogram. We need to have a high index of suspicion. An elderly patient presenting with breathlessness on exertion, with chest pain, or with any episodes of loss of consciousness, then we should consider the diagnosis of aortic stenosis. And this can be easily confirmed by doing a 2D echocardiogram, which can be done on OPD basis. And once the diagnosis is confirmed, there are treatment options which are available, which can be done in very elderly patients also. And with TAVI coming up, most of post-op morbidity and mortality also has significantly come down. And the lifespan after the procedure can be as normal as otherwise normal individuals. So a high index of suspicion is important. If there's any symptoms of breathlessness, chest pain, or any syncopy, you should consult your cardiologist. And further, he can do the test and diagnose the condition. So it is a easily diagnosable and treatable condition. Only we need to identify the symptoms once they present.
So thank you, Doctor. It was wonderful having you here on our program today.
Thank you.
So this brings us to the end of this episode. Remember, TAVI or TAVR is a minimally invasive cardiac surgery which significantly improves your quality of life for patients suffering with aortic stenosis. And we at Yashoda Hospitals are more than happy to answer your health-related queries, and do join us for next week as well. Until then, take care and stay healthy. Thank you.